So this one is someone who has tripped up, and so you've got to go for your high yield areas again. So when you're looking at a foot x-ray and you've got someone that is complaining of pain, the high yield areas is going to be the base of fifth. Oops. Pencil. So it's going to be the base of fifth. That's going to be the high yield areas. Even if you don't have a dedicated view of the foot and you've got a view of the ankle, it's still worth looking at the base of fifth, because so often that kind of fracture can get missed. So this particular base of fifth looks okay, and you can get different kinds of fractures where there's articular surface involvement or no articular surface involvement, which is a talk for another day. But that is one area that you want to be looking at in the context of trauma. Now, obviously, in the context of trauma, anything can get injured. But the high likeliness areas are going to be the metatarsal necks. They can get fractured as well. And the best thing to do is to really zoom in and just draw around, like genuinely just draw around. That's what I used to do, just zoom in and draw around every single one and make sure there's no fracture anywhere. Next thing to do is to have a look at the metatarsal heads, because sometimes what can happen is that you can get some kind of avascular necrosis, I guess, of the metatarsal heads, basically flattening of the metatarsal heads. And that is known as Freiberg's infraction. I think they used to say, or they say it happens as a marching injury. People who march a lot, I don't know why, but they would have increased pressure in these particular areas over here, and they can end up getting sort of flattening avascular necrosis of those areas. That's not the case here. We don't have that. So we're still kind of looking around. No one said anything just yet to say they found the fracture, which is fair enough. Don't worry. We're looking at the phalanges. They all look okay. And yep, you do get a bit of an overlap of the terminal phalanges with the proximal. But now when you come up to the big toe, you can see that there is a radiolucent line that is sitting around the tip of the great toe terminal phalanx. Is this a vessel? No, it can't be a vessel, because there's not much sclerosis as you get to the edge. And sometimes people have got confused with this one, because they think, okay, you can actually see the nail, right? How do I know that's not overlap of the nail? But just draw out the nail, right? You can actually draw out the nail. As you look closer and closer, you can draw out the nail bed, and this does not conform to the nail bed at all. No nail looks like that. So therefore, this is a fracture of the big toe terminal phalanx, and something that, gets missed. So very, very important that, yes, you do have high yield areas. That's kind of your quick look for fracture, no fracture, but then you've got to go do the hard work and really go through every single view and every single bone as well to make sure there's no fracture there. Right. No questions so far? Good.